Time now for this week's Health Matters. PA Lynn, Szabo, and myself, Paul Critz, along for the ride. And we've got something, this is like I guess mark this on your calendar. This is an important thing, isn't it? Coming up on the 11th of May.
Right. It feels like a blast from the past, but this is about COVID.
Oh,
and
man.
It's not past, although we're trying to define it as past.
Right, right.
So what's up? What's going on? On May 11th, they're going to end the national public health emergency. And so that means a lot of things. And it would be nice to have a heads up for people so that they could get ready, because it's not going to look good for the average guy on the street.
Wow. Okay. So I mean, starting with just like what the actual the facts on the ground are with COVID currently.
Where are we currently?
Yeah.
So these numbers come from Johns Hopkins, and there's still an increase in cases. So last week in California, there were 25,000 cases with 235 deaths. But we're kind of more like Oregon. So looking at Oregon, 2,623 cases with 39 deaths.
Wow.
So people still dying, and I still hear about it in the exam room. I still, see the grief. So it's still a thing. And keep in mind that the U.S. Is thought to have the highest case rate and death rates in the world.
Oh, wow.
And most scientists agree that that's underreported.
So how does this, I mean, like, how do these numbers compare? I'm trying to remember, how these numbers compared with, like, when everything was on fire in the midst of the pandemic.
I think it was more like 2,000 people to 3,000 people were dying in a day in the United States.
Yeah.
And then, of course, the case numbers are way, way, way.
Sure. But I'm trying to remember specifically California numbers so I can compare apples to apples here. So we've got like 25,000 cases over the course of a week. Right. And, back at the height of it, we'd get like 25, 30,000 new cases a day, wouldn't we? Yeah, right. Yeah. With 1,000 deaths or so. I mean, wasn't that what we were looking at?
500 to 1,000 deaths a day.
So, I mean, considerably less illness out there and less death now, but still not enough to justify the ending of the...
Totally.
Yeah, okay.
And I find it interesting, this is kind of an aside, but the slang name for the variant of Omicron that we have right now is the Kraken.
The Quacken? Why?
Kraken.
Oh, okay. Yeah. That had something to do with ducks. Okay.
No, not ducks.
That was a double pun.
Like really scary Pirates of the Caribbean.
Yeah, no,
sea
I get
monsters.
it. I get it all, but yeah.
So that must mean something. Anyway, so what's going to happen specifically on May 11th, 2023 is the National Public Health Emergency, I guess, declaration will end. And so here's what that means to us. And I looked at 3 specific areas that are medically related in 3 specific groups of patients.
Okay.
So the 3 specific areas are COVID testing, COVID vaccination, and COVID treatment, specifically Paxlovid.
Okay.
And we're looking at that in people who have private insurance, people have public insurance like Medicaid or Medicare, and people who are uninsured.
Okay.
So right now there's a big buildup of government supplies of vaccines, tests, and treatments. But these are expected to run out by spring of 2025. So the financial piece of all those tests that are probably sitting in a warehouse somewhere, as they have already been bought, the price is known, the government is absorbing the price, and if somebody needs those, then they're going to be made available free of charge. Okay. But the costs of the test, treatments, and vaccines are all expected to go up steeply. So after spring of 2024, the real costs, air quotes, I guess, of these 3 commodities are expected to kick in. Okay. And that means that people will be expected to pay them.
Wow.
Okay. So it kind of depends how much you have to pay. It kind of depends on what group you're in. Okay. So those with private insurance were likely for COVID prevention with vaccines, treatment with Paxlovid, and testing will likely pay higher copays than there's going to be some cost shifting. So let me say that again. So those with private insurance will likely pay higher copays and premiums. Premiums to their insurance.
Wow.
So monthly increased cost as insurance companies try and recoup what they've lost through the pandemic.
Wow. So that, I mean, so if you're saying a likely like premium increase, I mean, copays and everything, that's tied to specific treatments, to specific products, to specific,
Right.
but just your premiums going up across the board. They're just trying to recoup the cost of the pandemic in general to them, right?
Right.
Wow.
And probably what they perceive as the lowered price that they were contractually obligated in their dealings with the government. So those with Medicare will likely be forced into copays, and those who are uninsured are going to suffer the highest of the cost shifting.
Really? Wow. Well, yeah, because it'll have to be out of pocket, sure, yeah. Wow.
Right. And they're kind of a convenient dumping ground. And so, the United States, I think, is one of the only countries where a procedure, a medical procedure or medical treatment or a medical test costs differently depending on what your insurance is.
Wow.
So that's going to become like more in play here. Kind of a bummer. So here's some numbers as an example. Pfizer vaccine is right now about $110 to $130. No, Pfizer vaccine right now is kind of air quotes free because the government pays for it. It's expected to quadruple. Right now it's about $30. Expected to quadruple to $110 and $130 per shot.
Wow. Wow.
Remember, people get a shot, a series of 3, and then the 4th bivalent shot. Okay. Paxlovid, this is what I thought was kind of appalling. Costs the federal government at the reduced rate, $530 per course of treatment.
Man.
And I assume that there's 2 versions of Paxlovid. People might not know that. There's kind of a lower dose version for people that have kidney disease because these medications are hard on the kidneys. So if somebody already has failing kidneys, they get a lower dose, like a half dose. So it'd be interesting to know, is the 530 for the full dose, for the full, does it drop? I bet it doesn't.
Oh, man. No, yeah, I'm sure.
doesn't.
Yeah, that doesn't sound like something. That's not a savings they'd pass on to you.
No,
Yeah, exactly, yeah.
It's because most people don't even know it exists. But my guess is Paxlovid is going to really go up there and be incredibly expensive.
And Paxlovid right now is it's pretty widely used, isn't it? That's
We use it commonly.
Yeah, and I
It's
thought
super safe, fairly effective.
And,
It depends on effective at preventing the worst
right.
clinical scenario of COVID.
We had COVID this last week or week before actually kind of passed through the staff here. Not passed through the staff. That's making it sound. One of the youth reporters for Redwood Voice, his family came down with COVID. He didn't. And he and his dad went and lived in a hotel for a week while mom and brother went through Paxlovid. They got Pax. And we were talking about that. And that's a relatively new thing. I remember, just 10, 15 years ago, antivirals were rare. It wasn't something that was widely available, it seemed. If you got a virus, you got a virus. And if it was really bad and you went to the hospital, then we'd talk about antivirals, right?
Right, exactly.
And so now it's it's widespread use, and it seems it turned the COVID around in the household and got everything back together. But I had no idea it cost $530 a course.
I know.
Wow.
Me neither, actually. The other thing, and it's probably a good spin-off of what you just said, is I assume that there's, in that household, that there's people who are employed somewhere. And so it used to be up until about December, you could get 2 weeks of COVID pay. So if you were sick at home, and that disappeared in December. So I know the policy at UHS and both Del Norte Community Health Center is that you have to use your, accrued sick leave, which they bundle into what they call personal time. So essentially it eats up your vacation.
Yeah.
Especially if it gets complicated, because you're kind of mandated to be out of the work arena for 5 days. And if you get a secondary infection or sicker than you would think, that means that there's no vacation time. There's no other sick time in the year.
Right.
There's no other personal leave so that you can go to the specialists who are taking care of you after COVID.
Exactly.
So that's as you know, somebody who tried my best to not get sick, and I think so far I've been successful. That doesn't feel like much of a reward.
No.
For doing the best data-driven thing that we were all told to do. So anyway, and here's the other thing that kind of appalled me, and this goes on. There's a whole business capitalistic concerns side of this that I didn't even go into. I just looked at it simplistically from the medical view. But it's starting in April, the states have the green light to start taking people off Medicaid rolls. So the one thing that's not super talked about in the patient arena, but the providers are well aware of it, is there's been this drive to get people insured. And so it became super easy to get what we call Medi-Cal. That's what Medicaid is. Super easy to get it, almost super difficult to get off of it. Because, you know, I had a kid that moved to Pennsylvania in the middle of this, and she was on Medi-Cal here because she's an independent adult. And it took us about a year to get her off of it.
Wow.
In California.
So
But now people are going to be tossed off.
How are they judging who's going to be tossed off?
I have no idea. I think it depends on the state. So there's some states that are wanting to do this more quickly, and states that are headed by governments that are considered fiscally conservative.
Sure.
And there's some states, and I imagine California is one of them, that sees access to health care as being a good thing for their citizens.
Yeah.
And some people are going to just get tossed off. And my guess is they're probably not going to be super aware of it, because you get tossed off Medi-Cal in the days before COVID pretty easily and with no heads up.
That's right. Yeah.
Yeah. So 18 million people.
Hold on. I'm just trying to understand the justifications for this. So so there was a push to get people. Sure. So why? I guess so. That's more that just shows the shift in the capitalist stress. So before, when the government was paying for everything, they wanted to get everybody enrolled so that the government could pay for all of these things. And now that the government is going to stop paying for all of these things, then they're going to kick these people out of the government-sponsored insurance, and you're just on your own now because.
Right. And the article I read said the assumption is made that these people will just cross over into private insurance, which we already know isn't going to be such a great thing. They
weren't insured before.
Yeah, and now they're looking at higher premiums.
Oh, Jesus Christ.
I know.
Wow.
And then, so they say they're going to be able to shift them either to Medicare, which you have to be either permanently disabled or over 65, or to private insurance, which comes sometimes with employment. But if you have just under the magic number of hours or something, how are you going to do that?
Yeah, or are kept under the magic number of hours so that they don't have to do that. Yeah, exactly. Right. 18 million people, you said. I cut you off. Finish that sentence.
That's nationwide, and it's going to depend state by state. I think California will be less aggressive about it.
Yeah.
Probably most states will do a little something, but some states are
you're going to be on your own.
Yeah.
18 million people nationwide.
18 million people. So there's also COVID money that went to the community clinics and went to the hospitals, and all that's going to dry up. Went to KFUG, I imagine. Yeah.
We got
full disclosure.
We had a state grant for COVID messaging here, $50,000, and it was the easiest grant I ever had to get. And it was just simple, and wow, to have that kind of largesse, and then to turn around and cut it off. That just seems.
That's going to be painful.
That's criminal.
That is going to be painful. And a lot of people aren't really aware of it. They're like, yay, ding dong, the Wicked Witches did May 11th. Yay, go team.
Oh,
so the other thing, too, that I heard this morning, although I didn't really investigate it too much, is that the rental restrictions from evicting tenants are going to be lifted a certain period of time after May 11th.
Oh, okay.
But shortly after, so 30 to 60 days, depending on where you live.
I mean, and are these national things? Because my understanding was that California lifted those restrictions last year.
Yeah,
before.
All I did was it went in one ear and out the other.
Right.
So,
okay.
So my point being that there are going to be other financial things that happen to people that they don't see coming, and so maybe somebody that had a hard time paying their rent during COVID is either going to be all of a sudden immediately responsible for back payment of rent or evicted.
Wow.
So that's kind of tricky.
Yeah. And your point is well taken, too, is that there are other, not necessarily apparent, but sort of follow along consequences of all of this.
Right.
Too.
So what this sounds like, I think the Joe average listening to the announcements on the news, if people pay attention at all, is that we're in such a good place virologically.
Right.
And on the disease plane, that they're going to, it's a step back toward real life. But what this is a financial decision.
Oh my God.
And not necessarily a good one for Joe average patient.
No, because they're reestablishing the status quo. All the things and all the ways that the pandemic and that COVID had lent itself to the logic of, look, healthcare
for all
and access to healthcare. Look how important, look how necessary it is. And then now that it's not as necessary, or we're complacent about it now, or whatever, no, we're going to get back to the pre-pandemic
and the
announcements
status quo. That I've heard on the news about this coming, May 11th deadline is, yay, we beat COVID.
Wow.
No, we didn't.
No,
we didn't.
No.
It just said people want their money now. It's time to pay the piper, I guess.
Oh my God.
Ooh. So I have heard of...
Sorry, I'm so angry about this.
If there's no testing, and if it's expensive to get treatment and expensive to get vaccines, and then probably availability is going to cut back with that a little bit,
right?
Maybe a lot. And so why even test? You go back to if you're exposed to COVID at your cousin's birthday party and you feel a little sick, like you might have it, but why even spend the money to do the test? You're going to have to be off work for at least 5 days, and you're not, that's going to be a detriment to your personal leave. You don't really have the money, if you're uninsured, to pay for, the treatment. And then also it's more expensive to go to the doctor now or go to the emergency room, because a lot of those funds that were set aside for that situation are drying up. People are just coming to work sick.
So or
sending kids to school sick.
So not only is this whole scenario just morally repugnant, but in terms of the illness itself and of the pandemic, it could be a big step backwards as well.
Yeah, I'm wondering if they're going to be able to, if August they say erase.
Oh yeah, no, never mind.
Oops. Back to what it was.
No, we were wrong. May 11th was opposite day.
Somebody poked the Kraken, and now it's making its presence known.
Oh my God!
But I found this to be really horrifying, and here's the main reason I'm talking about it today, because we're all kind of sick of COVID. But so people have the option right now to still get free tests from the government. Super easy to do, and I'm going to see how much I can get away with.
Stock up.
One. Yeah.
Yeah.
You still have the option to update your vaccine. So if you haven't got a bivalent yet, or if you're in the middle of a round of vaccination, now's the time to step up and prioritize that.
Yeah.
And I don't know what Joe average patient does about Paxlovid. I happen to have some because I was at a healthcare provider. They wanted to protect me, so they made it available to me.
Okay.
But it's possible there's some still around, in various clinics and stuff. And so
but how would Joe average Johnny Bonghit, we used to call him?
So
how does he get a hold of that?
I wonder. I'm seeing if I was in let's say Del Norte Community Health Center acute care visit with somebody and they asked for it, I might try to go look for it for them. Really? Because right now it's free.
Wow.
And if I felt it was safe for them, their kidneys were normal, they're not on any medication that would be a problem with it, and they had a good reason, like a 97-year-old, frail mom at home. I'd make it available.
Wow.
I would certainly look into it.
So I want to take a step back, because so far as I know, and I've promised myself every week I won't keep bringing up my month's illness this year, because I keep saying I'm not going to bring it up. It's all done. I'm finished. Great. But it keeps coming up because it's like, oh my God, I've never been sick like that. Wasn't COVID, as far as 2 tests.
There's a nasty
something else going
around, yeah.
So, but But so that kind of bears like what I was thinking about, because I've made it this far, as you have too, which is remarkable to me, to like not getting COVID, which is just fantastic.
Well, you know,
wow.
it could be said on the scientific level that we both had it and we just weren't aware of it.
Yeah, we could have got. But so,
Right.
but here I did get, and I'm trying to remember when we did. I think we did. Oh yeah, we did the same time we did the influenza vaccine this last year, and we got the most recent
Bivalent.
the bivalent thing. So where am I as far as a booster then goes? Because I mean that's the rhythm we were in. You get it. You're going to get a booster every year, basically.
So you had
right?
3 initial ones. I think you had 3 Modernas, as I recall, and then also the bivalent. Did you have a bivalent Moderna or Pfizer?
I want to say Moderna.
Okay, let's just say it's Moderna. Then you're pressing pause right now, and I gotta say I haven't seen any data to be completely comfortable with that.
What do you mean press and pause?
That means that there is no recommendation for you to get any more immunizations against COVID at this point.
Really? Oh wow. Okay.
That makes me a little nervous. So I've been jonesing around for an extra one. I think I've said on the radio that actually I have one extra one. So, and I'm thinking of going for 2 extra ones. And this is what's killing me. This really expensive vaccine. You know, that somebody opens a 5-shot vial, gives 1 shot, and then it's only good for like 8 hours.
Right.
So it's tossed.
Yeah.
So I could accidentally walk into a needle.
Yeah.
do
Whoops.
that.
Yeah. We've got to.
Yeah. So the nurses are okay with that. So I don't know if I'll actually do it or now if I've just ruined my chance. But you know.
So so there's no
thoughts occurred.
no recommendation for a booster in my situation. But if I went into Open Door and said, "Hey, can I get a booster before the 11th?" Is that something that would happen? Or are they just going to say, no?
Depends who your provider is.
Really?
I might be likely to say yes.
Yeah.
But I think the other providers might be likely to say no. And the nursing staff, remember, the nurses have to follow rules, okay? And the providers have way more leeway in making medical decisions. So I think it depends more on the situation. You know, you're otherwise, young and healthy, I think, compared to me. And I think it's possible people would try and talk you out of it. It is a data-free zone.
Yeah,
So
I wonder what sort of.
There's no known answer.
How would they justify talking me out of it? Oh, you just don't need it. You don't. There's no indication that you.
I'm really busy. Don't bother me with stuff that's hard to do. But it depends. A lot depends on the moment.
Okay.
So,
all right, and you're there on Saturdays?
I'm there on Saturday. Okay. I am out of the box. As I say often in clinic, PAs don't need no stinking rules. So, but anyway, tongue in cheek.
Yeah.
So, I think right now the average Del Norte ought to like stock up on stuff as much as they can, and make sure that they have all their T's crossed and I's dotted.
And if you haven't gotten, and you are still called, indicated that you should have a booster or a vaccination, now's the time to do it.
Right, and people are completely clueless about the bivalent. They tell me very proudly, and they show me their cards that they have the 3. They're golden, and I'm like, let's get you the bivalent.
Say, oh, that's cute.
And they're like, what? So,
and I like your last line in the notes here. So is healthcare a right or a privilege? It's pretty clear.
Yeah.
That is, wow. Okay, well, so do that. Stock up on the testing, which is really handy. When I had my month's illness, I took 2 tests, and then Lisa just had them in the house. They were in the medicine cabinet. All right, let's take a test, and that was nice to know and to get a response right then, an answer. But
it's possible to go online, and it takes me about 3 minutes to send them to everybody I know, pretending I'm them. Like my parents who can't do that kind of stuff online. So it's super easy to do. Low bar to get it done.
Oh, for going on and having them sent to you. That's and if you haven't been vaccinated, go get vaccinated, because it might cost you something after May 11th. That's just ridiculous. So last week, I want to revisit last week. Last week we had a terrific Health Matters with Jermaine Brubaker from RX Safe Del Norte in here talking about naloxone and all of that. But you were in Scrubs last week, weren't you?
I was.
So you go up the road, you go do the clinic?
I did. I had the funnest time.
Really? What happened?
Yeah. So homeless clinic. I saw 7 people. We were there for, I think, 3.5 hours. Saw 7 people, but saw a lot of people I knew from walk-in clinic. So it was like, bro, go. I'm caught up because I haven't done it for, I don't know, maybe 2 months or something.
Oh, wow,
So
okay.
it was super, it's kind of like the people who work it are tight with the people who attend it.
Well, that's part of
And
the whole.
There's people who come back and come back and come back and get, probably there every week.
Well, yeah, that's
So-
part of the whole dynamic
Yeah.
of that. That's important to the mobile clinic.
And we were giving out Narcan like nobody's business.
Great.
Man. And so it was, but the weird thing about it is they're using their dental coach now, the one from Humboldt County, which is not in play in Humboldt County because no dentists. So they use it up. I know, it was so ironic. So they use it up here for the homeless clinics so that they can be out of the weather because it's cold and it's windy and blah blah blah. And here I am in this state of the art mobile dental unit, about the size of the newest Bloodmobile. 2 rooms, air quotes for rooms, with that totally equipped. The only thing it didn't have was a dentist.
Wow. That's
It was completely, completely every possible thing you could. It even had X-ray, onboard X-ray.
There's something I'd like to know, maybe for a future Health Matters. But we talk about with mental health, all healthcare, and so many other sectors of the economy too. Right now, it just seems like there's a what in the old days would have been called manpower, but there's humans that aren't there doing that job, and we say, oh, we don't have enough this, we don't have enough of these people, we don't.
Right.
Why don't we have enough healthcare people? Why isn't there a dentist available in Humboldt with this state-of-the-art mobile clinic? Why is that? Why?
I think it's seen as a burner job.
So is it?
So people do it for their first 2 years out of school so they can pay their student loans, and then they're out of there to more financially lucrative places.
So is that the draw? It's this: you can make more money as a healthcare professional
totally.
doing these other things. Wow.
Totally. Even one of the oral surgeons in Humboldt County, where almost all Del Norders go because she has higher expertise, actually doesn't live in Humboldt County. I think he lives in Palm Springs.
Oh, my God.
And he flies up. So he has a practice down there and a practice in Humboldt. So some are willing to dip their toes in it, but they don't want to commit to it. I don't know why. I think it would be dentally or medically interesting because there's no fluoride in the water, because a lot of people rely on wells, because I think there's a lot of congenital dental disease. Everybody with a bad set of teeth gets judged as being a meth user, and that's really not correct in this community.
No, they could be English. No, I'm sorry. I'm just that was the low hanging fruit. I apologize.
Okay.
That was easy. But yeah, no, that is very much a kind of a social thing. The bad teeth. You've got bad
It
teeth.
is.
We all know. Yeah.
It's joking about women's teeth is kind of a moment of hilarity in Humboldt County. They make jokes about Del Norder women teeth.
Wow. That's specifically.
Yeah.
That's a risible sort of wow.
Yeah, it's really sad. So the people who do come up here, are willing to put their heart and soul into it,
Right.
and then they start to burn out, and then they put barriers to care in their practice, which are hard to understand or explain.
Okay.
And then they finally, the barriers to care don't really work because it really is more freeing to not have barriers to care.
Do you, in the minute and a half we have left, can you explain or give an example?
Well,
of-
here's a perfect example. Del Norte Community Health Center used to have, you could only present one complaint at a time.
Oh, wow.
In the room. That's a barrier to care.
That is a barrier to care.
Okay.
Yeah.
And now people come in and they have like 14 complaints.
Yeah.
That's fine. That's up to the provider to say, look, these 3 are your main ones today. We're going to talk about that.
Right.
So if you're a chronic pain person, you have to come in every month to talk about your chronic pain, then that becomes the only focus of your health care.
Wow. Yeah. Sure.
So
Sure.
that's a barrier to care.
Right. Okay.
So that's
okay.
what I'm talking about. Weird rules.
So I guess I'm trying to understand with mental health professionals, and is it just that people aren't going into the field anymore, or is it just that when they get into the field, there's not as much recompense to a situation like coming to Del Norte and working, working in the mobile clinic, working in that? Is it just doesn't pay enough to justify for most people?
Right.
I'm trying to understand who's failing us? Is it the system? Is it the individuals who are going to become healthcare providers and are just being siphoned away to better money? Or
Right, I think it's the process that's failing people. So I'm graduated from college. I graduated from, I didn't personally, but my hypothetical self graduated from Harvard with a 4.0, and now I'm in medical school. And my first day of medical school, I am on fire to change the world, absolutely on fire. And then medical school is really difficult, and you don't sleep, and you kind of lose your will to do good. You just want to go home and not have to deal with other people's problems for a while. And then so you decide to go, you're going to be, instead of a family practice doctor who kind of get the brunt of, the worst of everything, you're going to be a dermatologist, because you can see a lot of people get paid really well and only be in the room, maybe at the doorway of the room, for 3 minutes.
And you probably got several $100,000 in debt. Too,
in debt, too.
Yeah.
And so you go into dermatology, you up the debt, but you work on Madison Fifth Avenue.
Right.
And you get a bunch of bucks.
Yeah.
So I think it's the system, because these people... Just for a contrast, we talked about Cuba. They advocate for people who are on fire about helping their communities specifically, and they keep that fire burning, even though they have rigorous schooling. It has to be done in Spanish. It's the biggest medical school in the country, but they take this person whose soul is still on fire to do good in their community, and they put him back in their community.
Yeah.
So that's what I think. That's what answers your question.
That does answer my question. Yeah, actually, that's really interesting to think about. And well, okay, all right. Well, sorry, we went a little long because I asked that question with a minute and a half left. But thank you for that answer. That was really, really good.
Sure.
Anything else?
Nope.
Okay. All right. It's Health Matters with PA Lynn Szabo. Thank you, Lynn, and we'll see you next week.
All right.